The money that is given for these posts is from the Nerve Tumour charity, and they work so hard at fundraising to be able to pay our wages, really, to be able to do what we're doing. Can you all hear me? Yeah, that sounds better, doesn't it? So I'm Rachel. I'm one of the nurse specialists based in Newcastle, but I see patients over here, over in Cumbria, and also as far down as Teesside, and also as far up as Northumberland as well. So I do recognise a few faces here today. It's lovely to see you. For those that I've never met before, it would be lovely to meet you today. So it would be great to have a chat at some point through the day with you. So I'm going to just talk a little bit about my role, what it involves. I'm going to give you a little very quick walkthrough NF1 and what that means to various people, because as we know it's a very variable condition and it affects people in completely different ways. So I'll touch on that as well a little bit. I'll also be talking a little bit about the complex service, which is based in Manchester. So I think every time I need to flick over the page, I need to walk over to the computer. And basically, I am partly funded by the complex team. 50% of my working hours are paid for by the complex team down in Manchester, and 50% of my hours are paid for by the charity, for which Karen, who was just talking, is charity director. My base is actually in Newcastle. I work 4 days a week, and Rebecca is my colleague who works 2 days a week as well. And between the two of us, we run the service that reaches out to those areas that I was talking about. I think the slide speaks for itself. Just basically that it works with patients and carers, families with NF1, medical community in NF1 and NF2. I don't actually work with people in my daily job Tuesday to Friday with people who have NF2. My work is concentrated within NF1, although I am employed by the charity on a Monday to deliver help for NF1 and NF2 on the Helpline, but I'll go into that a little bit later on. So obviously research is incredibly important and always moving forward. And also the charity works with supporters, volunteers and other charities. So I just put a slide up there just to, you're probably all aware, but I thought that it might be worthwhile just putting the slide up on the screen. We have a diagnostic criteria in terms of diagnosing NF1, and it lists 2 or more of any of these. So if you have somebody in your family who's affected, a parent, so mum or dad, and you have one of the following, then we can give a diagnosis of NF1. So sometimes there are variations to the rule, and some people don't fit that clinical picture, and when that happens, we're moving more towards doing blood tests so that we can identify the spelling mistake on the NF1 gene, which can identify the actual NF1 within the family. And we are starting to do that more and more, as well as the clinical diagnosis. But especially kind of earlier on in childhood, as somebody gets older, we have, for example, and this just may sound really crazy, but I remember we had a 70-year-old man who was referred through to genetics, who had had a fall, and they'd noticed when he was in hospital that he had café au lait patches, so the birthmarks that you have on your skin, and they said, oh my goodness, you know, he probably has NF1, and referred him through to genetics. He hadn't had many complications in his life, so we gave him a diagnosis of NF1 there and then. But in children, it's not always as clear cut. So sometimes, as well as this, we will do the blood test to try and identify, and that's usually managed within the genetics department. So, yeah, we've got café au lait patches there, which I'm sure you're all aware of, and the neurofibromas, which are the lumps and bumps that can develop on the skin. As we know, unfortunately, they can develop on the inside as well, and they can cause an awful lot of problems. and also the leash nodules on the eyes. So it's interesting, a lot of people do call in very panicked about the leash nodules that children will have on an ophthalmology check, worried about, you know, what these leash nodules cause. And yeah, an awful lot of people call in, and what I always say to them is it's another marker of having NF1. Just like the cafe au lait patches, the birthmarks on the skin, they're dome-shaped hamartomas just on the iris, on the coloured part of the eye, and it's just another indication that somebody has NF1. But we always, when a child is suspected of having NF1, we will refer through to the ophthalmology department so that they can get their eyes checked, because by the time somebody gets to 25 years of age, we would expect these leash nodules to be on each person who has NF1 in 90% of cases. So I put this slide up there just basically just to just show that NF1 can affect anyone in so many different ways. It is so variable, and I'm sure that, you know, when you're talking to other people within the community who have NF1, you know, when you're talking amongst yourselves today, you'll find that maybe one person will be affected in one way, and then somebody else will be affected in a completely different way. And I think that this is the complexity of NF1 in itself, and this is why, obviously, the charity just works so hard to raise money to put nurse specialists in posts like myself and Rebecca and Mary, because it can affect any body system. It's a nervous system condition, and as well as affecting the nerves and the skin, it just has so many different complications. And this is why we always say that it is so important for children to be taken to their annual checks by the paediatrician. It's so important for, as an adult, that you go to the GP on a yearly basis, and that you have your blood pressure checked, and that the GP has a look at you and talks about any signs and symptoms. And above all, it is so important that, you know, we put into our job education, and that we have a chat to you, that we put these information days on, that we're able to talk to you about all these different complications that you can have. And it makes it even more challenging, because I think that NF1, even though it is one of the most common genetic conditions, I'm sure, you know, a lot of you who have been dealing with this will go to your GP, and maybe the GP doesn't know an awful lot about this. And we are now working towards more and more trying to deliver education to GPs, and we do have centres over the UK where we have nurse specialists. The charity are working so hard to increase the number of nurse specialists in the country, so that you can ring into us, you can sound things off with us, we can get on the phone and we can speak to the GPs, and we can say, right, okay, you know, we feel that it's this. We can get in touch with the specialist doctors in the country that you know so much about this. But everybody is affected in a different way. There's no way of predicting how people are going to be affected later on in life. And that's why we're trying to just up the ante in terms of the support across the country. So as well as the health complications, and if anyone wants to come and talk to me about that at any point during the day, I'll be available, as will Rebecca and Mary, and Dr. Ealing will be here later on as well, and he's the consultant for, and it's Dr. Ealing, yeah. And he's a consultant for the Manchester Complex Service. So if any of you want to go through that with any of us later on in the day, I can talk to any of you, as we all will. But aside from the health complications, learning difficulties and behavioural difficulties in children can be a real problem as well. As a nurse specialist, my role is very much split between offering support for health and signposting and speaking to doctors and referring people on to see the specialists that they need to, but also going into schools and talking to teachers and trying to increase knowledge and education within the schools. So some of the difficulties that people can have, which carries right through into adulthood, can be problems with short-term memory, problems with fine and gross motor difficulty. So we're talking about handwriting, we're talking about being able to ride a bike, Maybe, some people might just be noticed to be a little bit more clumsy. And it's about getting the right support in at the right time, and being able to talk to the teachers about getting people like occupational therapy involved, educational psychologists. If a child is really, really behind and struggling academically, then it's about getting an education and healthcare plan in place. And sometimes it can be a bit of a difficult process, and as a nurse specialist, I'm very much involved in going into schools and talking to them initially and trying to get the ball rolling. In terms of an educational psychologist, the reason that's so important is because if a child has processing difficulties or short-term memory difficulties or difficulties with concentration, it's very difficult to unpick it all. And an educational psychologist will do a report and actually do a cognitive profile on a child, and then that report will be there, and they'll be able to adapt the strategies that are needed at the right time. So I think, as well as some of these learning difficulties, it's important just to notice that there are other comorbidities, so there are other conditions that are also evident in NF1, such as autism, and we're talking about 25% according to the research, and also ADHD, and with ADHD we're talking about 50%. So, that's a huge amount, and it's really, really important that people are aware of that when they're putting strategies in place and dealing with people. And as well as schools, we'll carry on that support into adulthood, college, benefits, all of these different areas. It's carried all the way through. And all you need to do is kind of pick up the phone and either call the helpline or call the local centre where we're based. So, yeah, I've kind of gone over this slide a little bit already. So my role is to assist doctors in clinic. So I'll be there in some of the paediatric clinics in the northeast. We're trying to move things forward all the time, but we have 5 joint clinics with paediatricians, and that includes a joint clinic with the neuro-oncology team in Newcastle, where we have referrals from here in Cumbria, Northumberland, Teesside, all over. We also do our own nurse-led clinics, which are transition clinics, which bridge the gap from children being seen up until the age of 17 through to 25. And that's myself and Rebecca in the northeast, and we will see people to talk through these signs and symptoms that people need to look out for. We'll talk through the benefit system, we'll talk through family planning, all these things that are really, really important. And we do the clinics here in Carlisle. We do them also across in Newcastle, and we do them over in Teesside as well, and people will travel and come back year after year. We do try to discharge from the age of 25, and then we'll say, right, okay, we've offered that support in a one-on-one situation in a clinic, and from here we think that probably it's best to discharge to the GP. And then what we do is we offer an awful lot of telephone support, and if someone wants to phone in and they've got an urgent problem, an urgent health problem, or I mean, the other week I was in court with somebody for a benefits tribunal. So these kind of things we can help out with. So that support is always there all the way through adulthood, but in terms of the clinic support, it's between 17 to 25 with a nurse specialist. We feed in and do an awful lot of signposting to plastic surgery, through to neurology, through to our soft tissue team, and also to the complex service, which see people who have more complex problems associated with the NF1. So that's kind of my role as a nurse specialist. I signpost, I see people in clinic, I offer education, and just there as a general source of support, really. So that map shows our patch. Between the two of us, Rebecca and I have approximately 1,000 people that we have to make sure that we're reaching out to, at least in a review letter every year. So if you get a letter through the post and it says we haven't seen you in a while, that's because we have a register of everyone who's been seen by our genetics service, and it prompts a letter just to let you know that we're there. We see some people more than others because of the nature of the condition, and some people are more severely affected in terms of complications. The informal links that we've got there just let you know the places that we can refer into. Because obviously, as nurse specialists, we're there as a signposting service, really, and an education service, and it's the doctors within all these specialisms that you're needing to see if you have these problems. But we're that connection, we're that kind of go-between that you need. And I think I've mentioned the others in terms of the complex service and also the clinics that we assist in. So, the complex service is, we have two. We have a north-south divide. We've got the complex service in London at Guy's and St Thomas, which Mary works very closely with Ros Ferner and all the other specialists within London. And people travel from, is it Birmingham that you go from? South down in Europe, okay, there we go. And then in terms of the north, anything up from there right up and to the border of Scotland. And in London, it's Professor Ros Ferner. I believe she's on Wikipedia, actually, so if you wanted to Google her, you'd be able to see what she's done with the service. And she was the person who set it up in the first place. In Manchester, it's run by Dr. John Ealing, who will be here later on today, and also Grace Vasello. Grace runs the service, and she is a neurologist, and Dr. John Ealing is a neurologist. Grace is pediatrics, so children, and John is adult. They do satellite clinics. They come up to Newcastle, and we've got one in Teesside coming up at the end of the year as well, and they will see people who have more complex problems associated with NF1. We have a certain criteria, and if you tick one of these criteria, you automatically are able to see one of these consultants within Manchester. The clinics are run twice a year by John up in the northeast, and we have 4 run by Grace in terms of paediatrics, and she links in with the neuro-oncology service up in Newcastle. So really, really vital that we have these. These are the big brains behind all the very, very rare complications that we have associated with NF1. And they're also there as support and guidance for us. And they put on an awful lot of education that we have to attend. And they're massively involved in research as well. So when I said that we have some coverage in the UK, this is it. You can see all the coloured areas are the places where we have nurse specialist input. Obviously, as I've said, there's Rebecca and I in the northeast in Cumbria, and we have Ruth Dreimer, who does Yorkshire and Humberside. We have Samantha Garden, who does Northwest and North Wales. Carolyn Smith and Melanie Murrell, who do the West Midlands. Helen Tompkins does down in the southwest and is based in Plymouth. And then the vacancies that are waiting to be filled are in Wales, Wessex and Sheffield. The money that is given for these posts is from the Nerve Tumour charity. And they work so hard at fundraising to be able to pay our wages, really, to be able to do what we're doing. So it's really, really important that keeps on moving forward, because without that money coming into the charity, these posts would not be there. So important. But as you can see, there are some areas in the country that just aren't covered. And for those areas in the country, there's me on the helpline on a Monday, and there's Carolyn Smith, who is based in Birmingham, who does the helpline on a Wednesday. So we will receive calls from anyone, anywhere in the country, usually in these places that don't have the nurse specialist coverage, and they will be needing the guidance that we're able to offer to, fortunate people who are in the area of the country where you have somebody kind of based. I also get calls from India, I get calls from America, I get calls from all over the world actually, and it's a really interesting job. It's really interesting to see how healthcare works in different places. But yeah, so we try to reach out to the whole of the UK and obviously other parts of the world as much as possible, and that's how we're getting around the areas of the country that aren't filled at the moment until the charity have enough money to be able to start increasing more and more support in the country. So yeah, I mean, I've just pretty much gone through it, but the helpline and the telephone consultations, signposting, definitely not diagnosis. You know, people will call me and say, I've just had a scan, can you tell me what it means? And I'll say no, I really can't, but I can tell you who you need to contact and what you need to do to be able to get that information. So I will, you know, try and talk people through it and try and just signpost and let them know where they need to go. Yeah, I think I've pretty much talked through what happens there. Sometimes people call in and they just need a bit of emotional support. Sometimes, you know, most weeks actually, I'll receive a phone call from someone absolutely crying their eyes out, not knowing where to go, not knowing what to do. And it's my job to try and help them. So yeah, that's the helpline. And that's the end of the presentation. So yeah, it'd be really good to meet, you know, you all. So at some point today, hopefully I'll be able to get around most of you. But thank you for listening.